Hello everyone, welcome to module number 5. This week is midterm week, so it's going to be a little bit less and a little bit more than what we normally do. But our focus this week is going to be on assisting with the physical examination and chart documentations. So for this week, we only have 2 chapters that we are focusing on. It's going to be chapter 11 and chapter 36. So let's go ahead and take a look at those individually here. So chapter 11 starts our discussion on written communication. This deals with our charting as well as formulating any letters or correspondences for your office that you're working with. Now when we talk about written communication, this does fall under the topic of verbal communication. If you remember, in the past weeks, we've been talking about how there are 2 types of communication, both verbal and nonverbal. Your nonverbal is all of your body language that you're using, but verbal communication includes written, oral, and visual communications. Now, as we're talking about written communication, it's talking about drafting correspondences, because as a medical assistant, that is one of the things that you will do quite often, especially because doctors will need to sign off on letters, or maybe it's that your employer needs you to draft a correspondence that can be sent to a patient, another company, or even to an insurance company. Now, when you're completing these letters, they must reflect the professionalism of the medical practice in which you work for. What you want to make sure that you're doing when you're drafting up these correspondences is that you watch your tone of the letter. You want to use a positive tone or positive attitude when you are writing these letters. You don't want them to come across as negative or aggressive, as that can send the wrong message to your patient. You also want to make sure you are using proper and professional grammar and word choices. Making sure that you're including things like technical terms. If it is a letter being sent to another provider, you can use those technical terms. They will know what they mean. Removing any gender biases that may be possible. You want your letters to be gender neutral. Make sure that you are using proper sentence and paragraph lengths. Watch for any repetitions or redundancies in your work. You don't need to, nor do you want to, continually repeat yourself throughout your work. That's not a professional way to handle things. Use an active voice versus a passive voice. Make sure, and this is a 100% in anything that you do, make sure that you are using spell check and proofreading your work. Just because it is a correct word, spell check won't catch it, but it would be maybe the wrong word to be using. So make sure that you are proofreading and using spell check. And as always, make sure that you are using references, if any. Now, when you are formatting a correspondence, you need to use a business letter style. When we're using a business letter style, there are some formatting pieces that need to be present. For example, a heading is the first thing that you need. This is usually your company letterhead. You want to make sure that you're writing letters on those, as it gives it that professional, clean look that you need. With the heading, it will include your company's name, the providers that work there, the address, telephone number, and fax number of the facility in which you work. You'll want to put the date, and that is the date that you're actually writing the letter. You want to make sure it is in a present time. The inside address comes next, and this is the line that has the name, title, company, and address of the recipient. Now, not always will it need a company name, but if you are sending it to another company and you're sending it to a person in particular, you want to make sure that the company name is on there. Then you're going to have your salutation. This is typically a courteous greeting that you give. For example, salutations, or to whom it may concern, welcome, thank you for being here. Something that is going to be an open, welcoming greeting. Then you have your body of information, or the body of the letter. I'm pretty sure that you all know exactly what that means, but it's really the content of what the letter is about. Then you have your closing. And in your closing, you should use words like sincerely or yours truly, making sure that it is professional again. You want to have your reference initials, your enclosure notification, and the copy notation, if any. Now, beyond just completing correspondences, you as a medical assistant will also be responsible for handling incoming and outgoing mail. When we talk about mailing, there are 6 classifications of mails that you could have come in contact with and handle in the medical office. The first one is a first-class mail. This is things like letters, postcards, business reply cards, and all of this will have to weigh less than 13 ounces to be considered first-class mail. Priority mail is first-class mail, essentially that weighs more than 13 ounces, but less than 70 pounds. And typically with priority mail, the person should receive this within 1 to 3 business days. Periodicals are newspapers or periodicals, magazines, that have received second-class mail, and these are typically things that are mailed to the general public. Standard mail is things such as advertisements, circulars, newsletters, small parcels, and merchandise. Package services and standard posts are merchandise, catalogs, printed material, or computer media. And the last type is priority express mail. This is typically available 7 days a week, and the mail that is sent with express mail is up to 70 pounds in weight and 108 inches around. And that would be received, again, within that 1 to 3 business days. All right, so that is chapter 11 for you. We are now going to move into chapter 36. And this chapter is going to focus on assisting with the physical examination. This is one of the key roles of any medical assistant. Our roles during this process include preparing the examination room, interviewing the patient, documenting all of the information in the medical record, positioning and draping our patient, assisting the physician during the examination, cleaning the room after the visit, and instrument care. So let's take a look at some of those categories closer. The first one we have is preparing the medical exam room. This will require you as the medical assistant to dispose of any used patient gowns or drapes in the correct disposals. If they're one-time use only, that would be the garbage. Unless soiled, that would then be biohazard. If it is a regular gown, that would be into the soiled laundry. You want to clean the exam table with a proper disinfectant and replace the table with new paper. Dispose of any equipment used during the previous exam. Again, if it's reusable, make sure that the equipment is cleaned and disinfected correctly. All surfaces in the exam room must be disinfected with the appropriate cleaner. And you want to close all the lids on your biohazard containers, and if it is full, remove and replace it. Next, we have our patient interviews. This is completed when you take the patient's health history. The history is broken down into 6 categories. You have your chief complaint, which is the reason for the patient's visit, the present illness, which contains the detailed description of the symptoms, things such as the onset, the duration, and the intensity of the problem. Past medical history. So this part of the history includes any diseases or medical conditions that the patient has been experienced in the past or has been diagnosed with in the past. The family history is a record of any health problems of the patient's blood relations. For example, mom, dad, brothers, sisters, grandparents, aunts, and uncles, all related by birth. Your social history includes the lifestyle patterns that could affect the health status of your patient. For example, smoking, drinking, recreational drugs, occupation, marital status, diet, and exercise. And then we have our review of systems. This is typically something that is done by the provider, and they will use different methods to examine the patient both internally and externally. Next, we have our patient positioning and draping. It's important to keep in mind that we want to make sure our patients are covered and they have dignity. Draping a patient is done so that your sheet is kept, the sheets are used to keep the patient covered and warm, especially when body parts are exposed. There are 11 positions that you could be responsible for placing your patient in. You have your supine, dorsal recumbent, lithotomy, Fowlers and semi-Fowlers, prone, Sims, knee chest, Trendelenburg, proctologic, and sitting. Now, when you are assisting with the physical exam, you essentially are helping the physician, and you're doing so in a way that by positioning the patient and draping them. If they're elderly or disabled, you have to help them a little bit more than you can a normal person. Handling the instruments, equipment, and other medical supplies to the provider when they need it. Documenting and labeling all specimens and making sure that they get to the labs where they need to be. Offering comfort to your patients during certain exams. Acting as a witness if it is a male provider with a female patient, or vice versa. You help to carry out treatment plans such as providing education, applying dressings, or administering medications. And then you also help with any diagnostic testing that need to be scheduled. You also want to really be a second set of hands and eyes for the physician during that examination. All right, this week, guys, what we've got for assignments. So first and foremost, I think the important thing for everyone to know is there is no discussion board this week. I know how super excited you guys are to not have a discussion board. So you get a week off here. But you do have your course project due this week. You're going to be looking at TB testing. So you want to do your VIS summary on the TB test, as well as a case study related to the TB testing. This will be due by Sunday, February 5th at midnight. You have one additional written assignment this week, and it's on positioning the patient for examinations. There is a worksheet that you will need to download, fill in the answers, and then resubmit for grading. That will also be due Sunday, February 5th by midnight. And the last thing that we have this week is your midterm exam. So midterm exam is going to be 35 questions, all multiple choice. And again, that will be due Sunday, February 5th by midnight. If you guys have any questions or concerns, please make sure that you're reaching out to me either via email or via phone. And I hope that you all have a wonderful and great midterm week. Bye, guys.